Hi, this is Dr. Dorette Nurhassan, board-certified reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today to discuss Polycystic Ovarian Syndrome, PCOS. PCOS is a common metabolic and endocrine disorder. PCOS can be defined if a woman meets two of the following three criteria. These criteria include irregular menstrual cycles, excessive levels of androgens that can be seen either clinically, such as excessive facial or body hair, or laboratory, such as increased levels of testosterone in a blood test. And the third criteria being polycystic ovaries on ultrasound. Now, a woman has to be ruled out for other disorders that can give the appearance of polycystic ovarian syndrome before giving her the diagnosis of polycystic ovarian syndrome. Other disorders include thyroid disorders, where elevated or suppressed levels of thyroid hormone can give the appearance of polycystic ovarian syndrome. Androgen disorders, where the adrenal glands and or the ovaries make excessive levels of androgens, can also give the clinical appearance of polycystic ovarian syndrome. And also hyperprolactinemia. Prolactin is a hormone made by the pituitary gland. The pituitary gland is a gland that sits at the base of the brain. When there's excessive levels of prolactin, that can also give the clinical presentation of polycystic ovarian syndrome. Once a woman has been ruled out for other disorders, most likely her diagnosis is polycystic ovarian syndrome. Now, women with polycystic ovarian syndrome can struggle with elevated body weight. For these women, I recommend that they see a weight specialist. It is very difficult for these women to lose weight, and therefore seeing a weight specialist can be incredibly important for them. The elevated weight can also be associated with increased risk for type 2 diabetes. And therefore, we always check women with polycystic ovarian syndrome for type 2 diabetes. Women with polycystic ovarian syndrome can have irregular cycles and sometimes no cycles at all for years. Because they don't shed their endometrium with a monthly menstrual cycle, that endometrium, which is the lining of the uterus, can thicken over time and become endometrial hyperplasia. In very rare instances, endometrial hyperplasia can become endometrial cancer. If a woman with polycystic ovarian syndrome is not interested in conceiving, she should start birth control to help her get a regular menstrual cycle. The most common reason women with polycystic ovarian syndrome present to see me is for infertility, and a lot of this is due to irregular menstrual cycles and a lack of ovulation. This can be easily fixed with pills such as clomiphene citrate or letrozole. In some instances, we have to move on to injectable forms of medications to help with ovulation. And in other instances, move on to in vitro fertilization, where the eggs are removed, fertilized with sperm outside the body to create embryos, and then the embryos subsequently transferred to the uterus. I have helped thousands of women with PCOS over the years to successfully conceive. For more information about PCOS, or myself, or my books, please subscribe to my YouTube channel, Fertility Dr. Dorette Nurhassan, or visit my website, www.noorhassan.com.